Hello, my name is Huang Wei Ling. I will begin my second presentation in this conference entitled, Are we vaccinating immunocompetent or immunocompromised patients for COVID-19? In recent decades, several new diseases have emerged in different geographical areas, which are Ebola, Zika, Nipah virus, and coronavirus. And recently, a new type of viral infection emerged in Wuhan, that's the SARS-CoV-2. Vaccines are a powerful tool to counter infections, disease, threats, and pandemic potentials, and the development of the experimental vaccines require a plethora of molecular techniques, as well as strict compliance with safety procedure. And the research and clinical data integrity, cross-validation of the results, and appropriate studies from the perspective of efficacy, potentially side effects have recently become a hotly discussed topic. And in this article, the 2020 Race Toward SARS-CoV-2 specific vaccines written by Thomas Karpinski et al. They present an update on latest advances and progress in an ongoing race of developing 52 different vaccines against SARS-CoV-2, focusing on registered clinical trials until November 2020 that fulfill the international safety and efficacy criteria in the vaccine development. And more than 103 preclinical candidates to vaccines. And the vaccines against SARS-CoV-2 should meet all at least the following requirements that are minimized under desired immune potentiation, be suitable for adult healthcare workers, be suitable for adults more than 60 years old, or with underlying diabetes or hypertension, and be suitable for long-term stockings. And in these 52 vaccines, including 13 with protein subunity, 11 with non-replicating viral vector vaccines, 6 inactivated, 6 RNA, and 4 DNA. For replicating viral vectors, and 2 virus-like protein, and 6 others. And between the preclinical candidates, 55 were protein subunity, 19 non-replicating viral vector, 19 RNA, 17 replicating viral vector, and others. And there are advantages and disadvantages to each vaccine platforms. Viral vector vaccines exhibit potential risks such as chromosomal integration and oncogenesis, and generally cannot be used in immunocompromised patients. And protein vaccines need adjuvants to enhance immunological response. At the same time, global scale deployments of attenuated vaccines is always associated with risks of pathogen reactivation and regaining its virulence in the future. All present every vaccine technology represents a compromise between good efficacy, safety, and a lack of side effects. And according to CDC, in the United States, 2 vaccines are authorized and recommended to prevent COVID-19. The Pfizer biotech COVID-19 vaccines and Moderna's COVID-19 vaccines. These both vaccines are made by RNA. And the European Medicines Agency has recommended the Pfizer biotech coronavirus vaccine for use in the 27 states. According to CDC, these two vaccines are indicated to all the population over 18 years of age, except for those who had allergic reactions to polysorbate or any other components of the vaccine, as well as allergic reactions after this first dose. Immunocompromised individuals can receive COVID-19 vaccination if they have no contraindications to vaccination. However, they should be counseled about the vaccines and safety profile and efficacy in immunocompromised population, as well as the potential for reduced immune response and the need to continue to follow all current guidelines to protect against COVID-19. An antibody test is not recommended to access immunity to COVID-19 after vaccination with COVID-19 RNA. In Western medical theory, the immune system has a defensive function. The cells of the immune system work together with different proteins to seek out and destroy anything foreign and dangerous that enters the body. And according to Andrea Cortegiani et al. In the article, immunocompromised patients with acute respiratory distress syndrome, secondary analysis of the lung safe database, immunocompromised patients are defined as all patients with at least one of the following conditions. Immunosuppression, defined as viral immunosuppression, neoplastic disease, immunosuppressive drugs, including steroids, chemotherapy, or congenital immunosuppression. An active hematological malignancy, such as the patient that still have the tumor, or active neoplasm, that the neoplasm that has not been resected still requires treatment or with metastasis. A patient without this condition are classified as immunocompetent. And according to Canadian immunization guides, immunocompromised persons are more susceptible to vaccine-preventable infections and may have severe infections. And the safety and effectiveness of vaccines in immunocompromised persons are determined by the type of immune deficiency and degree of immune suppression. Each immunocompromised person is different and presents unique consideration regarding immunization. And the relative degree of immune deficiency is variable depending on the underlying condition, the progression of the disease, and use of immunosuppressive agents. Immune deficiency can also vary over time in many people, and the decision to recommend for or against a particular vaccine will depend upon a case-by-case analysis of the risks and benefits. And there is a potential for serious illness and death if immunocompromised people are under-immunized, and every effort should be made to ensure adequate protection through immunization. However, inappropriate use of live vaccines can cause serious adverse events in some immunocompromised people as a result of uncontrolled replication of the vaccine's virus or bacteria. But today, I will bring to you a different point of view about the population we have nowadays in our world due to Hippocrates' quote that said that it's more important to consider other ancient medical tools prior to the knowledge we have nowadays. So I will show to you how our population are in the point of view of traditional Chinese medicine. Chinese medicine never discusses immunity directly. Instead, it describes the clinical symptoms of the body's response to the invasion of the external pathogens in terms of Zhen Qi or vital Qi, which protects human health by fending off invasion. In the editorial entitled Acupuncture and Immunity, written by Fengsha Liang et al., they showed that more and more research had revealed that acupuncture can regulate immunity, for example, to enhance anti-cancer and anti-stress immune function and exert anti-inflammation effects. And this may be the basis of acupuncture in preventing and treating later disease. Moreover, TCM focuses on the theory that prevention before the onset of the disease or intervening in the early stage of the disease is much better than treating after the onset. And to better understand the type of people we have nowadays, I did a research in my clinic between 2015 to 2020, measuring the energy of my patient through this anesthesia procedure that is done using a crystal pendulum positioned in front of this chakra, followed by the analysis of the pendulum movement to measure the energy. And energy means immune system in TCM. And the energy of the chakra is evaluated from a scale from 1 to 8, being 1 the lowest level and 8 the normal level. And I measured the chakra's energy of the 1,000 patients from in this period, but I was only able to analyze 409 files of these patients. And each chakra corresponds to the functioning of one of the massive organs, and each massive organ is responsible for the functioning of one external sensorial organ, such as the first chakra corresponds to the wood element and liver. The second chakra corresponds to the water element in kidney. The third is the fire, corresponds to the heart. The fourth to the lung, and the fifth to the spleen. Each massive organ is responsible for the production of yin and qi blood. For example, liver and lung for the qi, and kidney for the production of yin and yang, spleen for the formation of blood, and heart to control the heart flow inside the vessels. And what I found in this research is that all the patients, including children, young adolescents, young adults, and the oldest people, were in the lowest level of energy. This means that our immune system are very weak in all age groups, and they are not characterized by immune suppressive patients, but they have normal diagnoses such as anxiety, depression, headache, patient with knee pain, low back pain, all kinds of disease and diagnoses are in the lowest level of energy nowadays. And energy means immune system, and that's why all the patients today are considered immune compromised patients, and they are not immune competent anymore. And what is causing this lack of energy? This lack of energy, according to and this is another table, 20% doesn't have energy in the seventh chakra too. The seventh chakra is the spiritual chakra, and the patients that are in this group that don't have any energy in this chakra could have more serious evolution, for example, when they are submitted, when they have infection to COVID-19. And here's to show you that the remaining 11% of this study, I'm showing you that some patients have energy in some of the organs, but the remaining organ, they don't have energy. And traditional Chinese medicine literature understand that Zen Qi as the ability of the organism to protect itself from the influence of the external pathogenic factors. In this case, the COVID-19 is considered the external pathogenic factors, as well as the ability of the organism to recover after damaging influence of the energy imbalances caused by emotional distress or bad diet. And Zen Qi is formed by the constitutional energy of the kidney meridian and is part inherited from the parents and part acquired from diet. And TCM refers all pathogenic factors as malicious energy or Xie Qi. Here is to show you that when the person has normal Zen Qi, he will not have the infection or any kinds of the disease. But in this case, when the Zen Qi is lower, like in this study that the majority of our patient doesn't have protection, and this Xie Qi is bigger, they will have more gravity, the evolution to COVID-19 infection, for example. And here's to show you that we need to treat this balanced state of these four energies in all kinds of treatment. In this situation, when these patients do not have energy, they are not producing this energy adequately to protect the body against the invasion of these external pathogenic factors. And here's to show you that this P is responsible for the absorption of nutrients and production of blood, and heart to responsible for maintaining the blood inside the vessel. And also the kidney is responsible for the production of yin and yang. All of them were in the lowest level of energy. Here's to show you that, so in this study, are we not underestimating our immunocompromised population? Are our immunocompromised much bigger than we think they are? And immunocompromised people are not only those who have HIV, diabetes, immunosuppressive medication, but from this study, I have done patients diagnosed with anxiety, depression, panic syndrome, back pain, knee pain, headache, diabetes, etc., are all included in the group of immunocompromised because everyone's energy is very low. And the estimates of number of individuals at increased risk were most sensitive to the prevalence of chronic kidney disease and all. In the beginning of the pandemic, these patients that has this chronic disease were considered high risks. But in this study, I'm showing you that all the patients nowadays are considered high risks because they do not have energy. That's why we are seeing that on children, adolescents, and young adults, all kinds of people that do not have anything, any disease, are having COVID-19 or even are dying for it because of this lack of energy. And the patient described in this article already have comorbidities here, but nowadays we can see that not only these people are having COVID-19, but all the people are susceptible for this infection because of this lack of energy. And here I'm showing in this publication written by me that cancer patients always have cancer because they don't have energy in the chakras energy centers. And these can produce the heat retention that, according to TCM, cancer is formed by deficiency of energy and formation of heat. And that is why if we take out the heat and treat this energy deficiency, we can also treat the cancer patients with success. And here's to show you that patients all with kidney cancer or with a typical pap smear cell exam can cure or when we treat these energy deficiencies. And here I'm showing you the publication with patients that has urinary incontinence and sexual dysfunction post-cancer prostatectomy. And patients post-cancer of prostate, also they all have chakras energy deficiencies, and the treatment of these deficiencies can treat all these side effects after prostate cancer surgery. And also in HIV patients, they also have the second cause of immune deficiency, that's chakras energy deficiency. And this is the study that they presented in this webinar last year, showing that not HIV have the HIV as immune deficiency, but the chakras energy deficiency is as the second cause of immune deficiency in these patients. And also I have some publications showing that diabetes, patients with gestational diabetes, and patients with urinary tract infection, with chronic gastritis, and with chronic constipation, all kinds of symptoms, chronic patients have chakras energy deficiencies, and the importance of treating these deficiencies to improve their disease and improve their symptoms too. Okay, this is my presentation. I hope to present to you that all the patients nowadays are in immunosuppressive, it's not immunocompetent, it's immunocompromised, and this is important to every country to start to measure the energy of these patients to see if this, what I'm saying, is real or not. Because the sample I did in my clinic could be the sample of the whole world because of these electromagnetic waves that are in the whole world leading to this deficiency in energy. Thank you for your attention. If you have any question, I will be very happy to answer. Thank you.